be clear, it doesn't mean if you have any other type of mental health problems that that's not severe and that doesn't impact you in the same way, but it's just these sort of funny labels that we give to different types of mental health problems. My name's Dr. Juliana Onwumere and I work as a consultant clinical psychologist in the NHS, and I'm also an academic researcher here at King's College London. And so I guess I'm what you describe as a clinical academic. So I do some work with patient groups, but I also do research as well. So when we're talking about severe mental health problems or severe mental illness, the title and terms, to be fair, are used so differently from one person to another. A lot of people don't find it the most helpful term because people describe it and refer to it, even academics and clinicians use it in different ways. But generally, they kind of refer to a group of mental health problems that you might describe as, psychosis or bipolar disorder or major depression. And why they're kind of considered or they're described as severe is often because these are conditions that can typically have their first onset or first occur when someone's younger, during, adolescence or young adulthood, and they can continue for a longer period of time. And over that period of time, there might be periods when people are doing really well. So some people might not even know they have had those experiences, but they can then be followed by periods where people don't do as well, where they've kind of had a bit of a setback. In textbooks, we might describe it as a relapse and remission phase. So you might hear things such as somebody's had a relapse in their mental health problem. But, it's a term, a very sort of generic term that's very much, designed to describe a collection of conditions that people might often have to deal with and manage over a longer period of time. That's why they're kind of seen as a bit more severe. And I think sometimes what can be really confusing is, someone thinks, oh, I've got anxiety, is that not severe? Or you've got depression, that's more severe. It's not a very clear way of describing these types of conditions. What often is a really common question is, who does it affect? What's the numbers? And if you're looking at different studies, you'll see different kinds of numbers. But I guess the take-home message, if we think around psychosis, which is perhaps one of the most well-known or most common types of severe mental health problems, or just a mental health condition, let's just call it what it is, we know that it can affect anybody. It does not respect, where you come from or what you look like. It can affect anybody. But we also know that it can disproportionately affect some people from some groups. So, for example, I'm in the UK, and we know that if you are from a racially minoritised group, and particularly a black racial minority group, if you're from black African backgrounds or black Caribbean backgrounds, you can have significantly higher levels of diagnosis of psychosis compared to other groups. And that can, for many people, that can often feel like a real worry in terms of why does this happen? What's the causes? Is it about issues around diagnosis? Is it about all these other things? And, there's different types of research that's going on that tries to look and identify what some of those different factors are. But we know for sure, we absolutely know for sure that if you're someone with lived experience with psychosis, and that's part of another condition as well, that it is rarely one individual cause. It will always be a combination or a mixture of different factors. I think it's really important because when I've talked about that there are some groups that are more impacted or more affected by diagnosis, certainly in relation to psychosis, and that can have a really, I guess, the want of a better word, a really sort of negative impact for some groups, because you might be really concerned in terms of if you're having these experiences yourself, what would that mean? What would that mean if that was your relative? What would I do? Where would I go for help? And, they're understandable concerns to have, particularly if you're already from a minoritised group. We do need to know that mental health problems, irrespective of whatever their label is, happens to anyone. It happens to you, it happens to me, it can happen to anyone. But the worst thing if I'm just being brutally honest with you, the worst thing that people are often exposed to, or one of the worst things that people are exposed to when they have these problems, is how other people react to them, how other people treat them. So you're no longer, you know, that funny friend. You're no longer the person who was really bright here or did all those things. Yeah, some things might have changed in your life, but that's not a reason. I'm dealing with a mental health problem. I still need my networks around, and whilst I totally understand why people's networks can, you know, fall down or become smaller, but I just feel we all have a role to play in that, because just look around your groups, look around our groups. No one is unaffected by mental health problems. And if we've seen what's happened over the last 2 years with the pandemic, you can see how real that can be. And just trying to be around for people and letting them know that just because you have a mental health problem doesn't mean you are any less a person, and that we can talk about it. We can talk about it in the supermarket, we can talk about it in the barbers, you know, we can talk about it on the bus, it's no problem. I would say, in terms of if you have a mental health problem, or you are somebody supporting someone with a mental health problem, in my top 3 things to have is having a supportive network. You know, just think, even without a mental health problem, why are your friends and family and the networks that you're part of, why are they important? Well, they become even more important when you are dealing with a problem with your health. And it's not just to say that, you know, if you have a supportive network, that takes it all away. No, it doesn't. We know that. But what it does is make sure that you don't feel that you're just doing this completely on your own. Because, you know, when I mentioned in the beginning that, you know, often some of these difficulties can go on for a longer time, and there's periods of good health and less, you know, periods of, you know, not as good health. That's why you need a network around you. And where you get that from always varies from one person to another. What suits you will not necessarily suit me. And sometimes the people that you would hope to get some support and help from might not always be the people that can deliver that. And that's just how the world works. I'd always just say, try someone else. Sometimes you might find yourself talking about things, even with really close friends and family, and they might not always say the things in the right way or in a way that makes you feel supported. Totally get that why you wouldn't try that again, but there will also be somebody else that does. So getting the right support in the way that suits you and makes you feel okay is always the best thing to do.